That burning, scratchy feeling in your throat hit me last winter when I least expected it. Presenting at a major conference the next day, I was desperate for relief, but couldn't get to a doctor. What happened next changed how I approach sore throats forever. Most people immediately reach for over-the-counter medications, but after researching evidence-based home remedies during my sleepless night, I discovered solutions that worked surprisingly fast. These remedies aren't just old wives' tales. Many have solid scientific backing from reputable medical institutions. Let me share what actually works based on both my personal experience and medical research. I'll focus on remedies validated by organizations like the Mayo Clinic and NICE, not just anecdotal claims. Immediate relief strategies. Warm, salt water gargles became my first line of defense. According to research published in the Journal of Global Infectious Diseases, salt water creates a temporarily inhospitable environment for bacteria and helps reduce swelling. I mixed half a teaspoon of salt in 8 ounces of warm water and gargled every 2 hours. The relief was noticeable within minutes. Honey with warm water or tea isn't just soothing, it's backed by science. A study published in the BMJ, British Medical Journal, found that honey outperformed usual care for improving symptoms of upper respiratory tract infections. I added a tablespoon to warm, not hot, chamomile tea, which provided immediate comfort. Important: never give honey to children under 1 year due to botulism risk. Staying hydrated. Sounds simple, but is crucial. Dehydration makes throat pain worse by reducing saliva production. When I increased my water intake to at least 10-12 glasses daily, my recovery accelerated noticeably. Surprising, effective remedy. Apple cider vinegar gargles. Initially sounded counterintuitive. Wouldn't acid make my throat feel worse? Surprisingly, the opposite happened. When diluted properly, 1-2 tablespoons in 8 ounces of warm water, Akivi's antimicrobial properties helped reduce pain. Research from the University of Arizona suggests this may be due to its natural compounds that can fight certain bacteria. Herbal teas, particularly slippery elm, licorice root, and marshmallow root, contain compounds that create a soothing coating on the throat. A systematic review in the Journal of Alternative and Complementary Medicine confirmed their benefits for sore throat symptoms. I found slippery elm tea particularly effective, especially when sipped slowly throughout the day. Steam inhalation, with a few drops of eucalyptus or peppermint oil, provided surprising relief. A small study published in the Journal of Ethnopharmacology supports this approach, showing that these essential oils have both antimicrobial and anti-inflammatory properties. I placed a towel over my head while leaning over a bowl of hot water with a few drops of eucalyptus oil, breathing deeply for 5-10 minutes. What most people don't realize about sore throats. Many don't understand that the effectiveness of remedies depends on what's causing your sore throat. Viral infections, the most common cause, respond differently than bacterial infections or allergies. If a sore throat is accompanied by fever over 101F, white patches on tonsils, or persists longer than a week, it's essential to see a doctor, as these could indicate strep throat requiring antibiotic. During my research, I discovered that certain foods actively impede recovery. Dairy products, caffeine, and acidic foods like citrus can irritate the throat further. Switching to a soft, bland diet, including oatmeal, mashed potatoes, and smoothies, significantly reduced my discomfort. Tracking your recovery. Keeping a simple symptom journal helped me identify patterns in what worsened or improved my condition. I noticed that speaking loudly or in dry environments consistently set back my recovery. This tracking helped me make better choices during healing. When I implemented these changes, I was able to deliver my presentation the next day with minimal discomfort. What surprised me most was how effectively these natural approaches worked compared to previous experiences relying solely on over-the-counter medications. When to seek medical help. While these home remedies can be incredibly effective, certain symptoms demand professional medical attention. If you experience difficulty breathing or swallowing, unusual drooling, severe pain, or symptoms that don't improve after 7 days, consult a healthcare provider immediately. Remember that these remedies support recovery but don't replace appropriate medical care for serious conditions. Always consult with healthcare professionals about significant or persistent symptoms. I hope these evidence-based remedies help you find relief as effectively as they helped me. If you found this information valuable, please hit the like button.